I think the trade unions have actually requested our governments in Botswana in particular, where cases, positive cases amongst teachers have increased in the last few months. And we really need to find out how best we can protect our children at schools. They've called for closure of schools, for example, for a while, so they can monitor the process and put in place protection measures for children and teachers. How are we as networks supporting trade unions, especially the trade unions of teachers, to ensure that the governments heed to their requests for protection measures to be taken? Because there are gaps. We are working well together, but I think we have a weak relationship with the state or with governments where we can make a bigger difference as civil society to protect our children. And I think one of the speakers did mention that there's a shrinking space for civil society in the region generally. I think we need to work on that. We need to use our networks like SADC and others to help us become more effective by working with our governments more positively as strategic partners, recognized for the work that we are doing in our countries and in the region. Thank you, Madam.
Thank you so much. And those are some of the lessons that we learned, particularly around civil society involvement with government when it comes to the COVID-19 response, and how we can facilitate for schools to actually be safe, because now we are seeing a spike in children becoming positive and in the school environment. So those are some of the issues that we need to be looking out for. I want to end here, but before we do that, I wanted to check with the interpreters if the Portuguese comments on the chat, are these questions, are they directed to any of the presenters? Please.
Sorry. So from the chat, the question is, I didn't understand what prevented Burundi from submitting their report to the committee in 2020. I also want to thank DRC for their ratification of the charter. Thank you. That's a comment from the chat.
Would you want to respond to that, Frank? There's also Abubakar. Can you help respond to the Burundi question? Or do you need it repeated? Frank, Abubakar, if you can help us, but if not, you can also respond on the chat. We just wanted to check if you can quickly respond to it. Okay, I guess not. Madam Amelia, we will respond to that question on what had taken Burundi that long later on. Our colleagues who can help us understand better are not able to do that now. We want to move on, colleagues, and we want to recognize your right to food and the right to is it rest? Is it allowed leisure? No, that's for children. So we are giving you a 5 minutes coffee break, health break, stretch, grab something, and we are back here at exactly 25, huh? Is it? Yes, 25 to. Is my timing with the rest of the continent? 25 to will be coming back. So when we come back, we go straight into thematic sessions where we need to appreciate more around technology and the different aspects of the work that we do. And we'll start off with education, where we will have a different chair altogether leading us in these sessions. Thank you so much for your listenership. Thank you so much for your participation. And my colleague Chenge will be taking over the chairing of the next sessions that we're going to have. But we want not to go over the
exploring a number of issues. We are all aware that the COVID-19 context has brought in a lot in terms of its impact on children's rights and their welfare and care, and we need to just explore together through sharing experiences, through sharing best practices, just for us to get to understand better how we can deal with the issues around children's education, the use of technology, and a number of other issues as we grapple as CSOs to continue to protect and promote the rights of children around the continent. And it has been a challenging period with COVID-19, and earlier on there was mention of the shrinking space for civil society, but we still need to continue to find our relevance even in this challenging environment. So our panel discussions are really going to be a few colleagues sharing their experiences from what they have been doing as CSOs, and then we all then can come in through a plenary discussion and discuss the issues further. So we are going to have about 4 or 5 sessions or panel discussions rather. The first one is going to be on education, technology, and COVID-19. We are also going to have a panel discussion around psychosocial support in a crisis setting. We also are going to talk about documentation as a sustenance approach for CSOs in such an environment. We are going to also delve into the issue around the impact of resources for sustenance. I'm sure that's an issue that we as CSOs have also been grappling with within this challenging period. And then also have a broad discussion on utilization of technology to discharge our mandate as CSOs. So that's what our afternoon is going to be focusing on. So I'll go straight into the panel discussions already. We are starting with education, technology, and COVID-19, as I said, and we have our colleague from Zambia, from the Zambia Civic Education Agency, Judith, I believe you are there. You are going to be sharing with us your experiences for about 10 minutes, and then we will then go into plenary for that issue for about another 10 minutes before we go into the next panel. So Judith, I hope you are there. And if you want to share your presentation, if Jenny or Fresha, you can allow her to do that. Or whoever is representing Zambia, if you can take the floor now.
Okay. Thanks, Chenge. I didn't do a presentation because Felicitas advised that I just have talking points. Good afternoon, good morning, good evening, and whatever time we are on, colleagues. And thank you for having me. I'm coming from an organization called Zambia Civic Education Association, not agency, Chenge. And Zambia Civic Education Association is a member of the Zambia National Education Coalition. So the features of the right to education, the 4 A's, and also its complex, multifaceted approach of right to education, right in education, and right through education. And I hope that as I'm presenting, colleagues will follow where all these features fit. In terms of prevention and preparation, Zambia, we were caught completely off guard. Zambia has experienced cholera outbreaks in a number of times, and therefore preparedness for tackling cholera is, especially during the rainy season, is one that the government is well prepared and has been able to mitigate whenever it crops up. Okay, we're still with challenges, but better. COVID was a complete novelty. So
Sorry, Judith. Sorry, apologies to interrupt you. I don't know whether there is any way you could possibly increase your volume so that there is enough clarity, so that there can also be translation. Apparently, the translators are not, the interpreters are not quite getting you. So if you could get the volume up, or adjust your mic, whichever way, so that we get better sound.
Oh dear. Don't know way to raise the volume up. Maybe I just get closer to this. I don't know. To the am I better now? Am I better now? Hello. Hello.
Yes, any feedback from one of the interpreters to just let us know whether you can now hear Judith? Interpreters, can you now hear her?
Let her speak, then we see if you can hear her.
Judith? Hello, can you hear me now? Is that better?
Well, it's just fluctuating. It goes and come back. It goes and come back. Maybe the internet problem.
Oh, okay. Because
I think she should add a voice.
I can hear everybody very well, and I'm just not sure where I should increase the volume, because I can hear everybody loud and clear. Can somebody guide where I could go and which icon I should press on for increasing the volume?
Excuse me?
Yes.
I can hear the voice, except that it is too low. I don't know if you can increase it.
She's quite loud. We can hear her very loudly.
All right. Let me then listen.
Can I continue? Can I continue?
Yes, please. Please continue.
Okay, thank you. Yes, so the first reaction was to introduce sanitary COVID responsive sanitary wear in schools, such as wearing of masks, soap, washing, and the social distance. But our schools, our classrooms are quite crowded. So soon, the government closed schools on 20th March and waiting to see how the pandemic was going to pan out. Then when it carried on, there was a necessity to find alternative ways of teaching and learning. And surprisingly, Zambia has had the educational broadcasting services, the radio program since 1962. That was before our independence, and the television side of it since 1967, after our independence. But the education broadcasting services has, with successive governments, have neglected to maintain it or even upgrade it to respond to modern technology. So the learning itself, it started when there was need now to turn to television or radio. It was found that the education, the television was easier, because all one had to find was find a teacher, place that teacher in front of the camera, and the teacher would teach. But radio was different in that it needed a special content. Hello? Can I carry on, Chenge? Chenge?
Please proceed, Judith. I think it was just
so it was found that radio was difficult because the content had to be developed to radio. For example, mathematics. It is difficult to teach mathematics on radio, and it had to be specially designed for the radio. And then the other problem that was there was the reach. The reach was very poor. You know, the reach of both the television and the radio was very poor. And when ZANIC did a monitoring to assess the reach of the education through technology, it was found that only 15%, 15% was accessing that. The second challenge came in the educational services, the same Zambia Broadcasting Educational Services is registered as a community radio station. Therefore, they are not allowed to register countrywide. And the Independent Broadcasting Authority that monitors and that regulates, registers and regulates community radio stations refused to give access to the broadcasting services to reach the whole country. And they were just limited to Lusaka. Then mobile phone suppliers, they stepped in. Zamtel is a Zambian government, how do I say, anyway, it's Zambian government owned, and they stepped in to provide services at a zero rated charge. However, as time went on, Zamtel found that it could not bear the cost of providing these services. So they started charging a 5 kwacha per child accessing lessons through their mobile phones. And the government did not have the money to absorb these costs. So they just passed it onto the children and onto the pupils. And so therefore, only those that could afford could actually access these lessons. So then the government decided, okay, let's open the examination classes. And these are grade 7, grade 9, and 12. Let's open them. And with them being in school, the rest of the classes out of school, then the social distance and all the other COVID health protocols could be managed and sustained. And that's how the examination classes opened on the 1st of June. And now the focus of all of us, including CSOs, was, especially those in service provision, was to complement government efforts in donating masks, donating soap, donating buckets for water for children to use for their hands, and also to provide awareness raising on the importance of social distance. Masks is not a problem to maintain, but with the children like to play, they like to touch each other, they like touch games, and that had to be constantly reminded to keep the social distance. So when that happened, then the consensus in Zambia now has been that the education system needs to become a blended education system, because previously it relied heavily on classroom physical contact with the teacher. So a blended system, had to be embraced, where there would be physical contact as well as learning by technology. So the schools and the agreement now with all stakeholders is that what is good for COVID-19 should also be good for post-COVID-19. So whatever new methods of doing things had to be relied on during COVID-19 can still continue post-COVID-19. So a blended education service delivery has now been adopted in this country. And for that reason, the government has opened studios, television studios in every province to provide education platforms. And we are reliably informed as civil society that about $75,000 was spent on opening these studios to broadcast education services. And then also to equip each school with a television set and to purchase radio SD cards for schools, something like SIM card for a phone for each school to access this. And a focus to train teachers in provision of education through technology. So it was found that most teachers, especially in rural areas, have never even operated a computer, for instance. And so therefore, they had to be trained on, computer, how to use a computer to reach their children and also to deliver lessons. And also, we were going through, during the same time, Zambia was going through a massive load shedding. And so power was an issue and it affected the rich. And there is now a deliberate effort to switch from electrical power to solar power, and also to switch from conventional PCs to tablets and the use of smartphones. And in this case now, through an emergency fund for COVID provided to Zambia by the Global Partnership for Education, channeled through UNICEF Zambia, because they can't fund the government directly. There is more now, mobile phone providers who have come on board to use their platforms to deliver education. The impact during lockup, and even the president, when he appeared in Parliament this year to report to the nation on national values, he did state that lockup, the closure of schools, affected child protection issues, as has been alluded to by colleagues this afternoon. And he spoke to issues of violence against children and abuses, sexual abuses, and the dropping out of the children because they have either there's child marriages occurred as well as early pregnancies. So this was a side effect that has affected the issues of child protection. Although there were some positives, we engaged Zambia Civic Education Association. We engaged some children from the Child Rights Club on how they were coping during the lockdown. And some of the positives the children stated was that because even the parents were not going to work and the parents were not going to work, I mean, the children were not in school, there was actually some kind of family bonding. There was one girl who said for the first time, she's had very meaningful conversations with her mom, who is always busy and stressed because she's got a very stressful job. But this time they were able to chat and she was able to see the mother she hasn't seen for some time. So what CSOs we did was mainly monitoring government response and impact on the measures that it was doing, because the government, in trying to mitigate the COVID, did not have the capacity to also measure its own measures. So we were measuring and looking at issues of the rich and how much COVID protocols are being followed in the schools. We were also engaged in awareness raising on the pandemic among school children and mobilizing stakeholders to bear on the management of the pandemic, including children, even within government ministries. It seemed like, to begin with, the issue of providing education under COVID was left to the Ministry of Education alone. And it was through us, civil society, lobbying for a multi-sectoral and interdisciplinary approach that brought in even other ministries, like the Ministry of Health. So how do you support the Ministry of Education other than just managing cases that come to that? On issues of timetable of the lessons provided through radio and TV, this was lacking. Like, which subject is going to be aired at which time? So then we stepped in as civil society to disseminate the timetable to the pupils that needed to access this, and we were also involved in the development of the policies and programs to respond to COVID-19, and Zambia has come up with a comprehensive response plan to COVID-19, which is worth $10 million US, and this is where the support from the Global Partnership for Education was accessed through this same plan, and then the Global Partnership funded this. There is need resource mobilization, especially as from businesses, was also another issue where we came in as civil society, as a coalition, to lobby businesses to support learning under COVID, even beyond their social corporate responsibility. And we relied through the 10 business principles and children's rights adopted by the UN in 2012, I mean, of course, pushed for by UNICEF and Save the Children. So we've been disseminating awareness of the businesses and their accountability to children's rights beyond just social corporate responsibility, which is more a public relations. But now we are saying you are a duty bearer and you need to give back to the community, and that we have pushed that during this pandemic. Some of the lessons learned is, this same collaborative way that the government needs to push, that when issues like this come, it's not a government-only response. It needs every stakeholder to respond. And resource mobilization, like I said, needs to be broadened. And the dilemma that we have found ourselves in is that in Zambia, primary education is free. And the government of the day has been really highlighting this to the public for political expedience. Now, what has happened is that parents mishear primary free education, and now they apply to the whole education up to end of secondary. So they are refusing to pay secondary from grade 8 to grade 12 to contribute to their school's education. They are claiming that the government has told them it's free, but the government has only said it's primary education. But when parents come out strongly accusing schools of making them pay, the government, because of its political expedience, decides to be silent rather than reinforce the fact that the schools need every support that they can get, and even from the parents, especially in secondary schools. Then the other issue we found that although most children have mobile phones and they access internet, they are more inclined to want to spend their data on social media networking other than for learning. So they would rather spend time on their Facebook rather than open for education services. So this has been our experience here in Zambia. So on the 28th of September, because of the low reach in technology, providing education through technology, the government opened schools. All schools were opened from 28th of September last year. Then they closed, and again they just opened now. So there's this. It's still a learning process, and yeah. So our old system.
Okay.
Oh, yeah, physical delivery of education. So now we have, in order to cater for the COVID protocol, although schools have opened, there are multi-sessions. So children, especially in primary schools, are having 2 hours of contact, and then they're expected to spend more time learning through technology at home, so that another group can be allowed into the school to allow for social distance. Thank you very much.
Thank you very much, Judith, for that presentation. I noticed you brought in a number of issues to do with access to education for children during the COVID-19 pandemic. You brought in issues around affordability. You brought in issues around resourcing by the government itself, as well as the role of civil society within that whole space, where civil society in Zambia were then monitoring what government had committed itself to do. So you brought in quite a lot of issues, and the multi-sectoral approach also very important, because I believe this is something that a lot of countries have been facing as we have been grappling with COVID-19. It seems a lot of issues have just been left with the health ministries and then the education ministries working in silos. But definitely when we are looking at education and technology, there is need for even the energy sector to be involved, because we in Southern Africa, for example, there are power cuts, and you do want a situation where government responds by ensuring energy is available. The ministries of information and technology should also come in to play their part in a number of other sectors as well. So thank you so much, Judith, for that. And as we continue, just hearing the experiences, I'm just looking at the time and I'm saying, let's hear the experiences, and colleagues, just take note of any questions you want to have or any contributions that you may have around the issues we are discussing. I noticed that our colleague Lynn from MIT is also in this meeting, and I know that MIT works quite a lot even with governments in the region around education. So Lynn, I would want and request that you just come in maybe for 3 to 5 minutes to just add your voice. I think there would be a lot of value in hearing your perspectives on this issue around education and technology and the impact of COVID-19. I hope you are still with us, Lynn, so that we can hear from you. Lynn, are you available? I don't see Lynn. I think she may have just dropped out. I know she was with us just before Judith concluded, so it could be a network issue. But I will call upon her later on if she manages to come back. So as I said, colleagues, let's take note of our questions, our contributions. I know there are a lot of dynamics around education and technology that we can then discuss later. As I said earlier, we are going to be discussing. Oh, Lynn is back. This is great. Lynn is back. So Lynn, I was saying that I know MIT works a lot around education, even with governments. I just wanted you to add your voice on the discussion around education and technology, just maybe 3 to 5 minutes. So over to you, Lynn.
Sure, thanks so much. So obviously, like with every organization, we were impacted hugely with COVID-19 because we use schools as our entry point to reach children and young people. And last year we work in the SADC region, and we had so many disruptions to schooling. And so we had to look at different ways of reaching the children, the young people, but also the teachers, the school staff, and the health facility staff. So what we did several things. We introduced 3 new platforms. One was radio, and we ran several radio programs across the region. One was specifically around COVID-19, providing accurate information to the communities, but also specifically providing support to children and young people with respect to COVID-19. The second one was a program called Youth Talk, which was around the health and well-being of young people with a specific focus on accessing sexual reproductive health services. Because what I'm sure all of us working in the field, what we've seen is an increase in teenage pregnancies during COVID-19 and also a decrease in young people accessing health services. So we had a program, Youth Talk, that encouraged young people to access services, but also encouraged engagement, encouraged young people to call in and tell us how they were feeling, what kind of support they felt they needed, how they were supporting each other. And then a third program was Family Talk, and that was to encourage intergenerational dialogues. And the focus there was again around children and young people talking and engaging with their parents, with their community leaders around how they were feeling during the pandemic, how it was affecting them in terms of school closure, their mental health, etc. And then the last program was around climate change and looking at local youth-driven action towards combating climate change. So that was the radio programming. And then we introduced SMS messaging, and we chose SMS because although many young people enjoy WhatsApp, what we found in the baseline that we did across the region was not too many young people had access to smartphones, but they did have access to SMSs. And so we introduced an SMSing system that is bi-directional, which allowed young people to respond. So we would provide information and then we'd ask questions. We would encourage them to think critically, think about how they were feeling and then respond. And then the third thing we did was introduced an e-platform to the schools where we are working. And there we equipped schools with solar power because we work in the deepest rural, most impoverished communities, and most, well, in fact, none of the schools had access to power. So we introduced solar power, Wi-Fi, and we equipped the schools with laptops and data projector and screens. And we also did the same for the health facility that serviced the schools in a particular community. And what we're currently doing using that e-platform is piloting a telehealth service. So what that is enabling schools, both teachers and learners, to access health services from their local clinic, but virtually. Because what we also find in the rural communities is where the children need the health services the most, they're the ones that live the furthest from a health facility and they don't have easy access to transport. So we've introduced that as an approach to the provision of school-based health services, and teachers are trained on identification and referral, they're trained on ethical and confidentiality issues, and they establish a relationship with the local health facility. And obviously that e-platform, once a school has that, it can also be used for curriculum purposes in terms of reaching young people. And what we did as an organization, even though the schools were closed, teachers and parents would come to the schools in small groups, and we ran virtual webinars, workshops with the parents, with the teachers, so that we were still able to continue the capacity building, the engagement with the communities where we are working. So in a nutshell, that's That's how we responded in 2020, and we continue into 21 because we still anticipate some disruptions. So thanks for allowing me to share that.
Thank you very much, Lynn, for sharing those perspectives. Quite a lot of innovation that you've shared, which we can all learn from. And you also brought in some cross-cutting issues, really, the issue around environmental issues, psychosocial support, and also the link between health and education, which is quite interesting through the e-platform that you spoke about. I'm particularly also impressed with how MIT managed to come up with some sort of feedback or interactive platform through SMS or WhatsApp. And that also, I think, is a very good way of having children share their voices as they go through whatever challenges they are going through during such a tough time. So thank you so much, Lynn. And I know there are a lot of contributions or questions that will come up as we learn from each other, as we share all these best practices. So colleagues, I'll continue to ask that you either throw them in the chat or in the question and answer section, or wait for the plenary. Right now, I want us to move on to talk about something that Lynn actually raised, the issue around psychosocial support in crisis settings. And I know REPSI is here with us today to share their perspectives. Lynette, I've seen you're logged in, and I would like to give you this opportunity to take about 5 minutes to just share the perspectives around psychosocial support. So Lynette, over to you.
Good afternoon. I hope you can hear me. I am trying to share my screen. I hope that is there.
Yes, we can see it now, Lynette. You can go
Great.
ahead.
Okay, so I have just put together a few slides, which should not take me too long to share. Just briefly, I was asked to talk about crisis, not specifically COVID-19, but obviously living as we are within COVID, I've also brought in that context. So a crisis is an event or a period that may lead to an unstable and dangerous situation affecting an individual, group, or all of us. It's a turning point. And I was really happy to hear in the presentation from Zambia around what can we do that will continue. It's not that we did this during COVID and post-COVID, then we don't do it anymore. It's a testing time or an emergency. The impact of crisis is often it introduces risk. In COVID-19, we had illness, death. We still have illness, death. There were the lockdowns, and with that were the loss of economic and livelihood opportunities, the closure of schools and the loss of education, which is critical to development as well as hope for one's future. There was a loss of access to healthcare and other services, and there was abuse and exploitation. Abuse really went up against women and against children. Crisis can result in anxiety, worry, helplessness, hopelessness, panic attacks, depression, suicidal ideation, and grief. All of these risks that we have discussed. It also often makes you feel very, very isolated. And we depict that as feeling like you're at the bottom of a pit. where you have no meaningful human relationships, you are lonely, you're unable to approach others to find comfort, seek advice, and look for help. And families and communities, because it may be an individual who feels isolated, it may be a family, it may be a whole community, may begin to question their capacities and skills, their faith and their hopes. And this can drain people of their energy to even get up and move. Responding to a crisis, very, very often we respond to that which we can see or which is physical. And the psychological and social impacts come later. We underestimate how critical mental health and psychosocial support are in responding to a crisis. So when we began to think about responding to a crisis, the principles that underpin that response are human rights and equity of everybody, active and meaningful participation. Participation builds agency, builds confidence, builds your own psychosocial and mental well-being. We also think about not doing harm, because sometimes our interventions can have good intentions but harmful impact. Using and building on available resources and capacities, not bringing in resources and capacities which may be difficult to sustain. Integrated support, which is able to reach more people. We also think very, very much about the well-being of caregivers and responders. We really believe that you are only able to give what you have. So unless you have mental and psychosocial well-being, you cannot give it. You cannot help somebody else to achieve it. What we did in terms of responding to COVID was to look, as many others did, into how we could collaborate with the media. So we developed 6 different posters, and that's a picture of one of them, that had very simple psychosocial messages. We translated these initially into Portuguese and Kiswahili, which are the languages we work in, but then also into many, many local languages. And we shared these widely through social media. We did a lot of TV and radio interviews in different countries where we spoke about the need for psychosocial support in these situations, where we raised the issues around the violence that was occurring, how people were being impacted, how we needed to continue to reach out in the face of isolation and grief. And we also worked with radios to reach out to caregivers and partners, including actually supplying radios in some cases. And I think the solar-powered radios are absolutely fantastic. And the ones where you can have a flash stick with a program, so it doesn't have to be on radio as such, but it can now be played over again, and you can stop, you can listen to it, you can discuss it. And that can then be used in small groupings and small discussions. We made a number of presentations on different aspects of COVID-19 and different aspects of psychosocial support on Facebook. And these are now available on the REPSI YouTube channel. So if anybody would like to find them, you can. We went back to the principle that you can only give what you have, and focused also on our own staff well-being. So very, very early on, we conducted a survey amongst our staff. We are scattered around many different countries. We held weekly management meetings for about 3 months to review the situation, share what was happening, check on challenges, and come up with quick responses. We had regular staff briefings at both regional and national level. We used our platforms to support each other, share positive stories, share creative ways of reaching out, and plan for the future. We also did as much as we could to prepare our team to be able to respond. Staff were trained on psychological first aid and supplied with protective equipment, masks, and so on. We had guidelines on general protection measures and made sure these were accessible not only to our staff, but also to people we are working with. We had a support system with regular conversations, checking in, discussions on self-care, and a referral system. We made sure that those who were in the field, and there were countries where it was possible for us to have staff engaging directly with communities, had adequate communication equipment, and that there was bi-directional updates between us. And our response everywhere was part of the national strategy. What we found is that working together, it was possible, it is still possible, to build on individual, family, and community protective factors, and using that to improve the well-being and health, mental well-being and health, even in this crisis. And we believe the same can be true in other crises. Thank you very much.
Thank you very much, Lynette, for that very insightful presentation on the psychosocial support and what REPSI has been doing, especially in this crisis. And I like that you really laid it out to us what the impact of a crisis is, and not just COVID-19, because I think the predictions are that as we go forward, we may actually find that a number of new crises in different forms may actually befall us globally and even in the region. So thank you for laying that to us and putting it into perspective, and for sharing the innovations that REPSI has applied during such a period. So colleagues, we continue. And I hope you are also still taking notes of what the presenters are saying, and any questions or comments you may have. What we want to really do is go through the presentations and have plenary at the end, so that we can all share our thoughts. We are moving on now to documentation as a sustenance approach for CSOs, and I think this is a very important issue. Isabel from the Center for Child Rights at the University of Pretoria is going to just share briefly the perspectives around that. And Isabel, I'm going to give you 5 minutes. You may need to just summarize your presentation, highlight the key points so that we will have ample time for discussion with everyone else. So Isabel, over to you. I see, Isabel, you are there. I'm not sure what's going on.
Give her a second to join.
She's rejoining?
Yep.
Oh, okay.
Good afternoon, colleagues. Can you see me and can you hear me?
We can see you and hear you. Please go ahead, Isabel.
Thank you. And thank you, colleagues, for inviting the Center for Child Law to come and be a part of this engagement. So this afternoon, I'm going to share my presentation. Share screen. There we go. So I know that we're running out of time, so I'm going to try and be snappy and save time so that we can discuss. So my discussion is on documentation for civil society organizations with the objective of positively influencing policy and practice. So firstly, my name is Isabel Magaya, and I work in the Research Monitoring and Evaluation Unit at the Center for Child Law. And the university is a center-based NGO, which is also a law clinic. And what we do is we do strategic impact litigation, legislative and policy advocacy research. So with research, we commission our own and we commission and we conduct our own research. So depending on the expertise that is required, sometimes we've had to make use of economists to help us with some of our research. And our other line of work pertains to education. So we lecture both undergrad, law, and masters. So as I indicated, we're an impact litigation organization registered as a law clinic based at the university. So the fact that we're based at the university, it means that research is an important aspect of our work. And so the center aims to set legal precedent to improve and strengthen laws pertaining to children. And we do this through the 4 strategies that I mentioned: litigation, legislative and policy advocacy, research, and education. So in South Africa, we've managed to advance children's rights nationwide in areas related to social assistance, care and protection, children in contact with the criminal justice system, both as victims or, and offenders. We've advanced the right to basic education, birth registration, as well as the rights for children with disabilities. So documentation at the Center for Child Law, the why and the how. So I'll start with why documentation is an important element of our work. So we document to build and contribute to an empirical evidence base for all the problems that we encounter, the problems that children are encountering in South Africa. And we also document to determine the extent and the nature of the problem. So this helps us to understand the problem, and it will help us strategize in terms of how we're going to act in order to rectify or to try and address the issue. So we also document to have a baseline data. So this helps us to demonstrate impact of our intervention to our donors. So this is particularly important for our donors who, once they've given us money, they want to know whether or not their money has been put to good use. So we also use this baseline data for our own purposes to monitor our own work. And lastly, we document so that we monitor and evaluate our interventions. So for instance, we get a court order asking government to do something. So once we have it documented, when we look at whether or not government is complying with a court order, we usually document it in the form of a research and letters and so forth. So for us at the center, documentation keeps us focused on our targets, but we're also flexible and we can adapt and look at new issues as they arise, particularly now with COVID-19. So I'm going to talk about two strategies that we use at the center for documentation. So our first strategy is litigation. So we use litigation as a strategy to build our evidence base. So court orders are a strong indicator legitimizing our intervention. So we can use our court orders when we report back to our donors and say, look, we litigate, there was this problem that we identified in our research and we conducted, we litigated and we got this favorable court order. So one way that we use litigation to document is that we have smaller cases that we use to build towards a bigger strategic case. So I'll give you an example of some of the work that we've done with migrant children. So one example that we have that's more recent is that we assisted a young girl. She's a young lady now, she's about 20. And we're still assisting her. But anyway, Martha, it's not her real name. She left Burundi when she was 4. She came to South Africa with relatives. However, her aunt moved to Belgium, but Martha remained in South Africa. And attempts to adopt Martha failed and she was placed in foster care. However, attempts to regularize her stay in South Africa failed for one reason or the other. So she was in South Africa since the age of 4, but she had no legal status. She had no documentation. So we started assisting her just before she turned 18. And what we did, we demonstrated to the Minister of Home Affairs that the special circumstances that require him to exercise his discretion to give her documentation, well, to grant her permanent resident status in South Africa. So we demonstrated that she had no links with anyone in Burundi. She had been in South Africa all her life. She had a good relationship with the foster parents, and she was, I think at the time, she was about to write her final exams just before she goes to university. So that case, the minister agreed and he exempted, he granted her permanent residency. So now we're using the judgment from that case to build towards a bigger case that we're trying to assist undocumented migrant children in South Africa who have been in our care and protection system, and they're aging out of the system. So they do not have a legal status. They do not have, they do not meet all the requirements, but because they've been in South Africa for so long, it's a group of them that we're trying to get assistance for them, instead of just leaving them to age out of the system and then they age into oblivion and into issues of unclarity. So that's the first example. The second example is that we actually conduct our own research. So in 2013, we received a favorable court judgment where we found that the South African Department of Basic Education was failing. So there was an issue, a learner had been refused admission at a school in Gauteng, here in a province in South Africa. So what happened was that we ended up engaging in litigation. And when we received the favorable court order, what happened was that the government admitted that there was a shortage of schools in the province. And they promised that they were going to set aside budgets, enough budgetary allocations to build enough schools in the province, as well as improve school infrastructure. So we received the court judgment in 2013. In 2015, we decided to conduct a study where we looked at the extent to which government was complying with the court order, whether or not they were complying with the two promises that they made to the Constitutional Court. And we found that they were falling short. And we wrote to the Gauteng Provincial Education Department. They did not want to engage with us. And then in 2019, we conducted another study looking at the issue of learner placement shortages in the province as well. And we found that actually the department wasn't doing as great as it was. There were improvements, but they weren't doing as great as they should have been doing. And what happened in that instance is that after we published the report, firstly, we found that they were not, the department was not build enough schools was because they were not engaging in population-based planning. So because they couldn't cater, or they did not know the number of learners that were coming into the province, it was impossible for them for the department to build enough schools. So we documented this, so we've got these 2 research reports, and our next step in terms of advocacy on this issue is that we are now going to engage with the Gauteng provincial legislature. We're going to write to them, and we're going to send them the court ruling. We're going to send them our 2 research reports with the evidence that's showing that the provincial department is not doing as well as it should. And if our engagements with the provincial legislature do not yield the results that we're looking for, then we're going to escalate and we're going to take it up with the with the legislature in Parliament. So this is ongoing work. This is what we're actually busy with. So in terms of the center's advocacy, our research, so we conduct research and it feeds into litigation and our engagements with Parliament. So how does this happen? So we do our research, we look at the nature and extent of the problem, we document the problem, but also after we've done the research, we use the research as a strategy to help us figure out how we can tackle the problem. And then, so our research feeds into our litigation, we present our research findings, we present the empirical evidence to court, and very often, more often than not, actually, when we litigate, especially in the Constitutional Court, the Constitutional Court usually says that Parliament must rectify or must fill a gap in the legislative, in the legislative framework or in the law. They must rectify whatever gap there is in law. And our research as well, so we engage when Parliament now is rectifying the problem and they're fixing the laws. We use, again, our research findings coupled with the court order, and we go and we engage with the parliamentarians. So what are the key issues to sustenance for us in terms of documentation? I think it's being relevant, timely, and responsive. So when there's a problem, there's a need for you to conduct research very quickly so that you can deal with the problem while it's still timely. And one of the things that we found out at the center is that we need to bridge the research policy nexus. What do I mean by this? We need to ensure that once we have documented a problem pertaining to child rights violations, the research shouldn't sit in our offices, because that happens a lot. You know, we've conducted this research, we know what the problem is, but we don't do enough to make sure that it lands up in policy processes. So one of the things that we do at the center is that we try to understand the policy cycle, and we try to take advantage of policy windows. So these are opportunities when parliamentarians or when there's policies being developed and we've got this research evidence, we've tried to feed it into those processes. Another important thing that I think is a key to sustenance in terms of documentation pertains to the format with which your documents take. So we know that policymakers don't have enough time to read lengthy reports, competing priorities, and they're very busy people. So we always make sure at the center that our long research outputs have shorter pieces that are targeted at policymakers. So you could give a policymaker a 2-3 page policy brief that he could read on his way to Parliament, for instance, or to an event. And there you just put the policy relevant information that he can grasp. He can just have a quick scan through, and then he gets what we're trying to say. So at the center, our research is often accompanied by shorter pieces, which are policy relevant, such as policy briefs. And we also have infographics, which are much shorter and are pictorial presentations. And the last thing is that when we document, we also have a dissemination strategy. And here we try to have a set our targeted audience, and we are very deliberate in who do we send our information to. So we do a lot of radio, a lot of television, and we try to engage. And with each and every research output, we have a press statement, and we send it out to the major media houses in the country. The end. Thank you.
Thank you, Isabel. You had quite a wealth of information to share with us, and I know I kind of rushed you into it. but but thank you so much. I think this has been very useful in just understanding the importance around documentation, because with a crisis such as COVID-19, I think it has become important for us, whilst we are dealing with the issue on the ground, to also go back and document and collect empirical evidence, which you emphasized is important in order to enable us to think through our strategies and approaches on how we can then continue to implement our mandate as people who are looking out for the rights of children. So thank you so much, Isabel. And I hope, at another time we can get more out of you, because there's a lot really that we can learn from the center and what you are doing. We are going to welcome. We are going to move on now. We also want to talk about an important issue around the impact and resources for sustenance during these difficult times. And I'm going to call upon Salam from Plan International to share perspectives around that. Again, I'm going to ask you to make it 5 minutes. Salam, over to you.
Hello. Hello, can you hear me?
Yes, please go ahead, Salam.
Okay, thank you very much. So I'm just going to say a few words on Plan's approach, mainly on appreciating skills, knowledge, and direction. I think we believe that this approach will help CSOs who need to utilize and make an impact in their intervention. So we usually use an approach that's based on partnership. So when we say partnership, we develop different strategies, different processes, and also different approaches to that regard. I know it's very difficult to summarize all in the limited time that we have. I know we are way behind time schedule, but just want to emphasize on one aspect that we all need to take into consideration, because I think it will benefit the CSO forum and also civil society organizations who have gathered here in terms of their specific approach towards making a successful partnership, and also in terms of identifying which are the partners that work collaboratively in this area. So identification of partners who are like-minded, working towards the advancement of children and girls in Africa is an important step, I think, that we need to do in terms of having an impactful intervention, both at the AU level and also at the different regional level. So when we say identification of partners, I know we have this very good platform within the CSO forum, where different regional platforms, different regional networks collaborate and interact. But we also need to go further beyond what we have already and look for new ways, new approaches, and also new partners who are also doing the same intervention, the same advocacy on that regard. In order to do that, I think the first step that we all need to do is identification of the skills, the available skills. For instance, what do we have in Africa? Which organization, which civil society platforms are working towards the same objective and agenda that we also advocate for? So I believe that there should be a kind of a mapping exercise that we all need to do. Because if we somehow restrict ourselves into the sphere of influence that we already have, we might lose a very good advocacy opportunity, which is also being done by other organizations or by other platforms. So it would be good to have a mapping exercise on how we develop the different skills that we have in Africa, the different CSOs that are working in the same sphere of influence, and also the different incredible works that are being done at the ground level, at the country level, because this will help us in assessing the impact that's being done at the country level, and it will give us as a very good evidence and data in the different advocacy that we do at the continental level. So I believe that we ensure that we don't rely mainly on assumption, but based on evidence that we get from the ground. And in order to do this, I think we need to assess and map the existence of the different civil society organization in Africa, working towards the same objective that we have. The second point that I want to make is specifically on the purpose, like what's the purpose of the creation of civil society forum, or in broad, like what's the purpose of any civil society organization working towards the advancement of children's rights. I know, like every time we say like we work towards advancing the rights of children, advancing the rights of girls, but like what's the specific purpose if we want to build on the existing skills, and if we want to enhance the resource that we have, we must be sure that the purpose that we all have needs to be specific. Do we need to strengthen our resources first? Do we need to influence policymakers or the general public? Do we need to influence the government to provide, for instance, let's say appropriate service? Do we need to first resource our work so that we have the financial and human resource in order to do our advocacy? So this kind of question needs to be answered first in order for us to have like a specific way forward in our advocacy and also in our skills building. Lastly, I think it will also be good to assess the different risks that's overshadowing like the different works that are being done in Africa with regards to civil society, which is the shrinking space for civil society organizations and civic space. So even though like we highlight this as one risk, but there are many other risks that come along with that. So it will also be good for us like to assess the risk and what kind of mitigation measures are we putting in place. For instance, if we don't have the capacity to advocate at the country level, what kind of resources or platforms are we using to do advocacy at the AU and at the continental level? So this kind of assessment, I think, would also help us to kind of navigate the different skills, competences, resources that we have within the civil society organization. Lastly, I think as a major takeaway, I think it's always good to have an understanding of the different works that are being done at the continental level. So we all know, for instance, what the CSO Forum does, what the different regional network does, but we don't have like a researched and documented approach to what extent other forums, similar forums do in Africa. So it's always good to have an understanding and keep track of progress of the work that is being done in Africa, and also to provide like regular updates amongst ourselves and communicate. And at the same time, we should be able to also to give full recognition to each other's work, because complementarity in advocacy is very important. We cannot advocate as an organization alone, but we will have more voice when we do complementary advocacies and complementary messaging. So I think complementarity is very good. And we should ensure that whatever advocacy and messaging that we do, we try to involve as many as organizations and CSOs as possible. I think throughout the process, it's also good to review and identify any emerging capacity needs. Even though like the fundraising and capacity assessment is an ongoing process, it's always good to hold at some point and see like, okay, where are we going with this approach? What are the needs that needs to be enhanced? What are the challenges that we are facing, and who do we approach in order to fill these gaps and in order to address this challenge? So this approach, I think, will give us an assessment of where we are and an assessment of the different skills that we have within the civil society organization. So just want to highlight these points. I'll be happy to comment during our discussion points, and happy to be part of the discussion after our intervention. Thank you, Chair. Over to you.
Thank you very much, Salam, for those perspectives on the impact and the resourcing for sustenance. And I do agree with you that we really have to carry out certain important assessments. For example, you mentioned risk. You mentioned even an assessment of emerging capacity needs, which I think has been a wake-up call to a lot of CSOs as we have been faced with a crisis, and the need for mapping as we go beyond the new approaches and new partnerships that we would want to create. We need to also be mapping out what is currently existing in our current environment and context. So thank you very much for Salam. And I think that's an area that we can also, bring in a lot of ideas, and a lot of questions may come up as well as we go into plenary. Now, colleagues, we are having our last presentation for this panel discussion session, and the discussion is going to, the panel presenter for this particular one is going to be Jenny from Total News. She's going to be talking about utilization of technology in discharging the mandate that we have as CSOs. And I think this has become very important to look into, especially during this pandemic period. So Jenny, I'm going to give you just 5 minutes to just share your key points, your key observations, key issues that you want to raise around how CSOs can better utilize technology. Over to you, Jenny.
Thank you so much. Thank you. Sorry, I'm listening to myself. Thank you so much, Chengetai. So I'm going to be very brief. I'm sure this needs a whole session of 2 hours, but how can we use technology to be better, to better improve our work? Number one is communication. Okay. So technology has improved the way we communicate. I'm sure every organization, every company, every group, you have a WhatsApp group. WhatsApp group have made information instant and feedback very instant, and it has helped our communication. Technology has also helped us in the way we reach children. Okay, we can be able to reach children at an instant. Okay, we can be able to do advocacy. Okay, we don't need to buy big advertising on the newspaper or a big billboards. We can just do a social media campaign, and we're able to reach, and we can be able to advocate for children. And then the other thing is real-time data collection. Okay, there's so many programs right now. There is so many tools that can be used for you to be able to collect information for children. So on children, for example, if you want to get data on the number of children who have been abused at a community, you just need to have maybe a chief or the community health worker or the community social worker having an app who can be able to be entering the data every day, and that data can be processed and can be able to help you make decision like continually, like at an instant. For example, I just click and I see how many children have been abused this week. I can be able to make decision. And then technology has enabled us to have a meeting like this. I'm seated right now in the Total News studio, and we have people from across Africa listening to me, okay? And probably right now, if it was not for COVID, probably would be somewhere in Addis or Lesotho or North Africa somewhere doing this meeting. But despite of COVID, we have been able to have this convening and because of technology, it has reduced the whole world into a small village. Like basically at the click of a button, you can reach so many other people. And so how can you take advantages? You can be able to reach more children by training, or more of your workers in training. You can be able to give them resources. So that brings me to the fifth thing, learning, okay, and training, continuous learning and improving ourselves. So you can use technology to be able to improve your team by providing resources, online resources, by providing online training, by providing one-on-one support, so that they can be able to improve their learning and their education. So and in the future of technology is evolving. Okay, I've said it has improved our service. Okay, there's artificial intelligence coming up. There's virtual reality that is coming up that is going to change the way we do our things. Okay, with artificial intelligence, you can be able to predict. Okay, predict things of the future. Can we be able to predict, for example, we have coronavirus this year. Maybe it's in another 50 years, we're going to have a pandemic. What can we be able to do in case of a pandemic? Okay, we can be able to with data that we have right now, we can be able to predict what times of the year do we have a spike of a particular abuse, or when do we have the spike of, and be able to come up with mitigation and do a mitigation before it happens. That's improving the way we do our services. Virtual reality is bringing issues like, for example, you can take yourself from here to the field. You don't have to go to the field. You can bring the field here, or you can bring whatever where you are to the field. So that using technology. But as CSOs, we need to be able to embrace this thing, and how can we be able to use it? How can we be able to co-create using technology? How can we be able to come with solution using technology? There's so many platforms that we can be able to. There's so many opportunities. The gaps are humongous that we can be able to use to improve our work. But again, technology, if I don't do this, the online abuse people are going to be on my case. There are challenges that come with technology. We have online abuse, that including bullying, sexual exploitation, child labor, all those ones. They come with technology. There's hacking. Okay, there's a big organization that was hacked the other day. But how can but that the good of technology always overpowers the bad of technology. And by this, to be able to mitigate some of these challenges, we need to come up with policies. I love what Sam said earlier. Being able to pass the Malabo Protocol, we need to push our state parties, our countries, our governments. Only 9 countries, let me see if I can remember them. Ghana, Rwanda, I can't remember them. I was hoping I can remember them. But only 9 countries have been able to ratify the Malabo Protocol. How can we push if your country has not ratified, can we push it so that at least you have 15 and it can come into effect? And it will be, so for those ones who don't know the Malabo Protocol, it's the same as the GDPR. What we are using currently, what Facebook, Zoom, Google is using is the European Union one. And when we already have ours, okay, as Africa. So my challenge to you is check if your country has ratified the Malabo Protocol and talk to them and let them ratify the Malabo Protocol. So that's my challenge to you. Please talk to your country. Okay, check with your government and push for the ratification. That way we'll be able to have protected our children. We'll be able to have protected our businesses. We'll be able to organization with what other people are doing. Like, for example, our data right now, we're on Zoom. Who is using this data? We are on Facebook. Who is using that data? It's not Africans. It's someone in Silicon Valley, in California, in America, not us. So how can we be able to ensure that our data is protected? And it can only be protected if you have our own legal framework. If your own country at state party level doesn't have a legal framework to protect you from to protect online, please push for it. If we don't have right now, we don't have one at the regional level because it's not come into effect. Thank you so much. I'm within my 5 minutes. Thank you so much. Bye.
Thank you so much, Jenny, for your perspective. I know you're very passionate about this area around technology and you have raised very useful issues around how we as CSOs can make use of technology, but also going beyond that and then talking about the policy perspective around use of technology and how the governments should then prioritize also to put policy in place that favors the protection of information and use of technology in our country. So thank you so much for that. I would like to thank all the panelists at this point for all your presentations. Can we kindly all mute our mics, please? Okay, so we started off with the discussion on the education and technology and the impact with COVID-19 from Zambia, and we also had MIT come in on that. We had a presentation on psychosocial support in a crisis setting. We had a presentation on documentation as a sustenance approach for CSOs. We then moved on to the impact and resources for sustenance, which Selam took us through. We have just now had the utilization of technology in discharging our mandate presentation from Jenny. So thank you so much, all of you who are our panelists. And I know that there should be a lot of people who would want to just, add their voice or perhaps ask questions. I invite you at this point to ask questions. If there are any in the chat box, maybe Jenny, you can assist me with those. So our presenters, we will just take a round of questions, and after that, we will ask you to respond.
So we have comments. We have comments.
Okay.
So we have comments. I'm going to read one from Eric. Some countries have serious censorship, and at times they experience internet shutdown. What are available resources of support out there as CSOs can utilize to keep CSOs in the country in touch with the world and share child rights issues of their concern, especially during critical and emergency situations? That's I know internet governance is a big issue, and internet freedom is a big issue. And in Africa, it's something that we are grappling with. Okay, in Kenya, I can say Kenya is one of those few countries where we can be able to go online and we say whatever we want to the leader of the country, and you at least it will not be shut. Okay, but I know in some countries it's very strict. But I think the more we advocate for freedom of internet and internet governance, the more it becomes a reality that internet. I think someone has written a paper on internet as a human right. So internet is no longer a luxury, but human rights. Can we start advocate as CSOs to having internet as human rights? But that one, as Sam is reminding me, it's only 5 countries that have ratified. That is Rwanda, Senegal, Mauritius, Namibia, and Guinea. So only 5 countries have ratified the Malabo Protocol. So what if we need to push? So, and one of the Malabo Protocol, one of the principles there is the freedom it's freedom for the internet. If you can be able to push for countries to sign, that means the countries must adhere to ensuring that there is freedom of the internet. We have able to access the internet. Thank you so much, Chengetai.
Thank you very much, Jenny.
Sam, go ahead. Sam, go ahead.
Thank you very much. Thank you for the presentation and the presenters. The one that I want to touch on is the hybrid system in Zambia. Now, one of the challenges most African countries face has to do with access to the hybrid form of education for people with disability, especially hearing disability, and sometimes those with visual disability, but also power outages is a big issue. And so I'm wondering how Zambia is managed to communicate and also implement education without necessarily being affected by power outages. I know Zambia is one of the countries that has very severe power outages. And so with power not being available, with girls not being able to go to school, how does education become a reality based on the presentation that she made? Thank you.
Thank you for that question, Sam. I'll be taking more questions at this point. Jenny, you can assist me to check if there are any hands raised so that we don't miss anyone who wants to contribute to this discussion.
Okay, I can't see hands up. Let me just check if the Q&A has questions. Okay, even the Q&A doesn't have questions. I think people are satisfied with our conversation. Thank you so much. We appreciate what you have given is enough. I can't see any hands up, Chenge.
Thanks, Jen. So may I call upon Judith perhaps to respond to Sam's question?
Thank you, Sam, for that question. Like I said, not that everything has worked well. We have, yes, during the height of the pandemic last year, of the COVID pandemic last year, we had seen massive load shedding as well. And like I said, between television and radio is much more accessible than television. But that radio has challenges in using it to teach, especially when you have subjects like even mathematics. This is for the children who do not have disabilities. So yes, the children with disabilities were the ones that faced challenges of accessing education, but those that could access television, and when it was working, they could, because teachers, live teachers, were actually teaching on television, and they can see if it's graphic, no, not graphic. The deaf ones had sign language interpreters there. So this is one of the challenges, you know, the learners that have disabilities, they suffered a lot more. So going forward, like I said, the country is planning to move from providing or from relying heavily on electricity, but to relying on solar. So the issue of inaccess by children with disability is one of the challenges that was very, very clearly focused. And that's why at the beginning of my presentation, I said that all the features, the 4 features of right to education were brought in sharp focus, and especially as they relate to the complex, multifaceted right to education, right in education, and right through education. So it was found that it was, you know, the technology, whereas it has the potential to be an equalizer, was really not an equalizer, but it actually marginalized the already marginalized learners. Thank you. So it's a work in progress. It's not perfect.
Thank you very much, Judith, for responding to that question. I notice, Martin, your hand is up. Please go ahead and ask your question.
Hello.
Please go ahead.
Okay then. Good afternoon. My name is Martin. Thank you for this presentation. I've heard from all the presenters, but a few questions in line with advocacy. One, we have issues to do with access to internet and even the costs. I don't know how our governments can really try to bring network close to institutions where learning takes place. Then 2 is about the power problem, most especially when they talk about solar and the gadgets that can really use solar effectively. that can last for long, because normally some they're not sustainable. Then the other thing is about the teacher capacity building, because most of our teachers are traditional teachers who normally act as instructors, not as guides. In this case, they tend to dictate or flow on their own, but leaving out the learners' input, which also hinders the use of technology. And the organization I'm coming from is Uganda Society for Disabled Children, which looks at the marginalized, especially children with disabilities. So you'll find someone demonstrating maybe on a TV and saying, this times this, which leaves out a blind child. And maybe even that gestures, the body language, which also hinders the communication bit during the learning process. So I want maybe one of the presenters to contribute or give any highlight on that. Thank you.
Thank you, Martin. Jenny, please go ahead and respond. Sorry, I will attempt to respond. So the first question is about access. Yeah, access to internet is a big challenge. And I think over the last few months, I've had this conversation with children, and all of them, they say it's access to the internet. I think this is where we need to do advocacy work. And also, for those ones who are donors among us or who are listening to this video or later on, so my challenge to you, can we start reallocating our funding, okay, to ensure that there's access. And access, it comes in two ways: access to internet itself and access to gadgets, okay? So you can have the internet, but you don't have the gadget. But can we be able to ensure, can we work with telcos? These are like in Kenya, Safaricom, MTN, or Airtels, or all these Mangos, okay? Can we be able to work with them to ensure that we have access, that the internet is there? Okay, we can be able, and I'm sure if it makes business sense to them, they sure take internet where it is needed. Okay, if you can say we have 20 schools in this particular locality and we need internet there, we as organization are willing to provide gadgets. Can you provide internet? I'm sure no telco will say no for that. One, is good for them, for their PR. And number two, it's good for their business, because apart from the school, other community members will be able to access the internet. And then gadgets, it doesn't have to be expensive gadgets. Right now, we can get gadgets for $20. We can get gadgets for $50, and we can get gadgets for any amount of money. If you can be able to convince I hope you can see me. My internet is flipping up. So if we cannot convince people that the telcos that in a human right, as I said, I'm going back to what I said, that internet is a human right. And we need access, and children, being a human right means it's a child right. So we can be able to convince them that it is easier for telcos to take internet there. And then for us as CSOs, we start looking for resources to take gadgets to children. The other question is, teachers need to be capacitated in all way, in all round. So we need to capacitate teachers in issues to do on how to use technology, on how to train technology, on how to use technology to teach. Okay, that's a big issue. And I think that's an ongoing work. And 2020 has proved to us a way of it boosts this for us. So for me, it's a challenge to us to be able to change the way we do our things. Thank you very much. Thank you, Jenny. And I'm sure, Martin, you are sufficiently responded to. Lynn from MIT has also just sent her response on the chat. She says, with respect to the question around teacher capacity and teaching methodologies, MIT Africa has recently developed a child and youth participation framework for schools, and we are currently testing it in 4 SADC member states. Its purpose is for schools to include children and youth in every aspect of their schooling. So that's something that MIT is doing, and I think this is something we can learn from as we continue to innovate and adapt to how we work in respect to children's rights. I am not seeing any more questions
all comments. Neither do I see any hands up. Okay, I see a hand. Mitch, you can go ahead and share your perspective.
Thank you very much. Thank you very much to every presentation that has been made. I think my comment mostly on sorry about that, on access to budgets and access to telecoms, ICT. I think it's high time now, civil society, we look at the way we've been implementing. I think COVID-19 has somehow forced us to do that. Is our programming up to standard with the fourth industrial revolution? And I think in ICTs, and we need to start now engaging business. How do we bring business to the table when it comes to issues of children's rights? How do we harness those opportunities? How do we go to Vodacom? How do we go to MTN, as suggested by Jenny? How do we use those expertise? How are they supporting our data collection when it comes to issues around children? How do we approach them? Are their policies child-friendly? All those kind of things. I think we need to start looking at that, bringing business to the table. And I don't think on this forum today we do have business. I think we need to start those engagements with business, seeing how we can work. And furthermore, I think it's high time now we start looking at those donor areas we can source funding outside our traditional donors that we know, outside from your what are these donors, outside US, outside global. Those donors that we are used to, how do we harness the philanthropists within Africa? How do we approach them? How do we bring them to the table to do advocacy for children? Because now we realize we have an issue of access. There are so many children that are going to be left behind. So 10 years from now, again, or 20 years from now, not even 20 years, a year from now, 3 months from now, there are so many children that are going to be left behind that would, because of lack of access. I think something that we have to start thinking about, how do we bring business onto the table? How do we do research? How do we incorporate them? How do we even partner with them on areas that have to do with child rights? That was my contribution. Thank you very much, Chengi.
Thank you very much, Mitch, for that contribution, and very important indeed. We need to be reflecting on how we have been doing our work as CSOs and adapt and innovate, and the issue around the private sector also very critical. I'm just looking through the chats. I don't see any more questions or comments. Neither do I see any hands up. So I am just going to attempt to summarize what we have discussed, or our takeaways from this particular session on the panel discussion that we've just had. And then I will wrap up this session before we go to the end of our meeting.
Hey.
Okay, if we could all mute our mics. I don't know, Judith, is your hand up, or is that is your hand up, Judith? I could give you just a minute, really.
Okay, I just wanted to respond to Mitchell that even as we start focusing on other means of supporting child rights and say maybe access to education, we need not forget that the primary duty bearers are the governments. And if we're going to look for non-traditional donors to the education sector, let it be led by the government. They are the primary duty bearers. Let's not shift the responsibility to respect, protect, and fulfill children's rights from the primary duty bearers to either the immediate as the family or the business that is there. We must not lose that focus and have a complete policy forum has shown that many of our governments wait for donors to fund services to children, and they leave the gross domestic product to others, they allocate to other programs in the budget. That way, this is unfair for those to be funding our education system, especially our education system, which is not just the right, but also a vehicle by which others realize. So I just wanted that caution. We must not forget that we are not the primary duty bearer. The government is. Thank you.
Thank you very much, Judith, for that. And as I had said earlier, I am just going to kind of summarize some takeaways. And these are just a few things that I picked up, overarching things that I picked up as we were discussing. But of course, there's a lot of other issues that were raised, and we can then, continue to reflect upon those. So I noted that something came out of this discussion around the need to continue to innovate and adapt to the environment, but that we need to be informed by evidence. We need to gather evidence. We need to document so that we are able to inform our strategies and our interventions during the crisis period, but also going beyond. And something that really came out clearly was also that whatever strategies and interventions that we are thinking about during this COVID-19 environment should not just be limited to this pandemic environment, but rather we should also be forward-looking and ensure that we adopt strategies that go beyond this particular crisis. And I liked how the issue around even the principles around how we should be thinking about our strategies, the principles around human rights and equity. And equity is one issue that comes up a lot as we are talking about access to technology, especially around education and children's access to education during the pandemic, and the aspect of the principle of participation, do no harm, and also building on available resources, etc. I thought that those principles are really overarching, and that we should also always be thinking about that as we are implementing as CSOs. Also coming to mind is the overarching issue around how we should continue to advocate around government policy around access to education during COVID, and a whole lot of other issues, other cross-cutting issues that came out during this discussion. We need to continue to put pressure on our governments to respond adequately to these issues, and that also brings in the aspect of resourcing by governments. We need to continue to advocate for resourcing, not only to respond to the pandemic, but also beyond, because I think this has been a test for our governments to see that they are not investing enough in education and in health and other sectors that are cross-cutting, and the impact has been seen through this pandemic. The issue about CSOs exploring new partnerships, very important, and it also ties in very well with the last point coming from Mitch around how we need to relook at how we have been implementing, what our strategies have been, and as we do that and reflect and think about new partnerships, we also have to be informed by perhaps carrying out mapping of what currently exists and what perhaps risks could be there, and just assess ourselves as CSOs, not only around ICTs, but around our skills, our knowledge, and also emerging need for new skills and new expertise within our sector. So I think that's the summary I have. A lot was discussed, but those are some of the takeaways that I thought I would just share with you. And because of our time, I'll just thank you at this point for participating during this panel discussion. And I'm handing over time now to Felicitas so that we can come to a point where we actually get to be wrapping up our meeting for today. So thank you everyone for participating in this session. Over to you, Felicitas.
Thank you so much, Chenge. I think in terms of the way forward, you've already summarized the session in terms of what are the issues that are coming out of the session, and perhaps those issues that we need to be looking out for. But in terms of the way forward from here, is that we are going to utilize the recommendations that were coming right from the beginning when we were doing solidarity messages to the last session, and see how we can see through and come out with an outcome document. I think we're only engaging with the committee on Tuesday, so we will circulate it on Monday, perhaps after 12, so that you can have a look at it. Those that can have a chance can also input into it before our presentation on Tuesday. The other thing that we are also going to be doing, we had shared an activity schedule. We have a work plan for the CSO forum because we also engage beyond the 2 sessions that we seat. So we had shared the work plan on the larger CSO forum. If we haven't done so on email, we'll do that so that you can also appreciate the dates, because there are some activities that are happening with in dates that perhaps a region or a country is on holiday. Unfortunately, as the CSO forum Secretariat would not know that, but we have shared those dates so that already members can already be telling us or pointing to us that such and such a date would not work, so that we can work around some of those dates. We will be having a series of side events next week as we start the CSO forum, as we start the committee sessions, as we start the committee sessions. If you are interested to having an event on any topic that is aligned to technology and to the charter, aligned to sustain the work to see what we can do for us to have that meeting. We really do feel that, yes, we have been having this tradition of conducting these meetings on a Saturday, because back then when we did that, it was because we were traveling and we felt that we needed to align when we meet with when the committee meets, so that members do not incur costs of flights and accommodation, perhaps twice, coming to the CSO forum and then going for the committee sessions. So we needed the times to be much aligned. We finished the CSO forum and immediately we go into the committee sessions, so that the costs for flights and accommodation can be once off in terms of facilitating for people to participate. But maybe because we are now conducting these online or virtually, maybe it's time that we relook into the exact day that we meet, because as you would have seen today, we had a lot of people leaving because it's a Saturday, and people that you can actually have with your family and friends. So we really do appreciate the fact that you were able to be here with us and here for the whole day. We don't take that for granted. It goes to show that you are committed to ensuring that children's rights do become a reality in this continent of Africa. I also want to sincerely thank all the presenters and the organizations that they're coming from, because some of them really, we were now relying on bilateral relations that we have with them to say, you can't refuse us. We need you to help us and help the CSOs to really appreciate some of these issues. and help them to do things better and much more effective. So thank you so much for having been here. I particularly want to mention REPSI, MIT, and the center, the Child Center Law for having been here, because some of these organizations, it was their first time being here, and we appreciate that they could make it on a Saturday. So thank you so much. Thank you to all the participants who are on the platform. We really do appreciate your presence. We appreciate all the comments, the questions that were asked here, and some of those that we didn't have responses to, we'll look into that. And to our partners and donors, really, we can't thank you enough. Save the Children, Plan International, we can't thank you enough, because you continue to hold our hand, you continue to support the sittings of the CSO Forum. And I hope, as you pledged to continue supporting civil society organizations, that even as we have now an independent organization being the CSO Forum, I don't know if it will be called that you will even support that organization and its personnel to continuously push for this structure to really work effectively for everyone in Africa, and ensure that children really live in a conducive environment in this continent. Lastly, a big thank you to the interpreters. You have been amazing. We know that we moved beyond your time, but you've been amazing to make sure that we can hear each other. We are in the Africa continent, but we speak different languages. And the fact that you are there as a catalyst for us to understand each other, we really do thank you really for facilitating that process for us. And to the Secretariat team, you guys are amazing. You put in the work, and it's evident in terms of the product that we have in staging these sittings for the CSO Forum. Everyone, thank you so much. Have a great remainder of your weekend, and please do take care of yourselves. Sanitize, wear your masks, and make sure that if you don't need to be out there, that you stay indoors. Thank you so much.